So here, so this is going to be a lumbar puncture and the epidural anesthesia. The lumbar puncture, we know that we do the lumbar puncture. We run a line here, the line which is between the two iliac crest. So we take it here from this iliac crest to the other iliac crest, and that will be the L3, L4. And this is where we do the lumbar puncture. We know that that is the spinal cord, which is, if this is the spinal cord, is going to end here at the L2 in the adult, or the L3 in the young children. So, and here there is another sac, which is the dural sac. Dural sac is going to go and end until the S2. It's going to end at the S2, and here you will see the spinal fluid in this area. So here, this is the end of the spinal cord. This is the end of the dural sac. And we know here, if we want to take the spinal fluid, which we're going to see in the next page. So with these people to which we want to perform, on which we want to perform the spinal anesthesia, um, so anesthesia is for a painkiller or something like that, or for pregnancy, for delivery. So this is the other one, which is the injection of the anesthesia, or to extract the cerebrospinal fluid. If you want to extract the cerebrospinal fluid, then you're going to have to go into the subarachnoidal space. But with these people, you need to check first if the intracranial pressure is high. Okay, so if the intracranial pressure is high, then you don't perform it, because if you perform it, then we know that in the skull, if this is the whole skull of the person, and in the skull contain opening that is called the foramen magnum, and in the foramen magnum, through which the spinal cord and the spinal cord and the area of the brain stem, they communicate in this area. So the brain stem and here. So then, and the brain, of course, the brain is going to be inside this skull here, and then underneath here on the back, you will see the cerebellum, and the cerebellum have some tonsils. Those tonsil, if the intracranial pressure is high, then this tonsil will herniate, because when you open here to do the spinal tap, the liquid is going to want to rush out, and while it is rushing, the pressure here is going to push everything to come this way, and is going to cause herniation of the of the of the cerebellar tonsils. So that's why it is contraindicated to do the spinal tap to those people with the increased intracranial pressure. So then here, how do we do the spinal anesthesia or the lumbar puncture? So here, the spinal anesthesia, we need to go through the following layers. So this is how we inject, and this is how the person is going to lay. And the person, as we told you earlier, that the spinal cord is going to run in the middle here, is going to run down here, is going to end at L2, at L2. So at L2, so it's going to end somewhere here. That will be the spinal cord will end there. But then the dural sac is going to go through an S2, okay, all the way to the S. So you're going to inject in this area, which is already the spinal cord already end. But what layers of the skin of this person, what layers are we going to pass through until we get there? So we're going to pass through the skin, which is number one. After the skin, underneath the skin, we're going to find the connective tissue and some fat. Then we will find also the fascia. After the fascia, we're going to find the supraspinosus ligament, the supraspinosus ligament. So supraspinosus ligament, this is the ligament that is going to be on top of this spine of the vertebra. So, and then there is the interspinosum. Interspinosum are going to be between these spines. These are the spine. Between them, that is the interspinous ligament. On top of them, that will be the supraspinous ligaments. And then underneath, which is between them here, there will be the ligamentum flavum, which is this one here. Ligamentum flavum or flavum is going to be underneath here covering. So it's going to create a cavity. It's going to create a cavity in this area. So this cavity, that will be the cavity in which you will find the spinal cord and all those the other part of the spinal cord. So then if we pass the flavum underneath this ligament, we're going to see this epidural, which is the above the dural space. Above the dural space also there is like connective tissue and fat, I believe. And then after the epidural space, which is this is the area, if you want to do the spinal block, then you end up here, and that's it. But if you are trying to extract the spinal fluid, which is going to be found in this pink area, then you're going to continue. And by continuing, then you're going to pass the dural sac. So the dura, and the dura is this wide one. So above it is the epidura, but this is the dura. So you're gonna pass the dura, and after passing the dura, you're going to pass underneath the dura, which is the arachnoid. And the arachnoid, after you pass the arachnoid, then you're going to reach the subarachnoidal space. Subarachnoidal space, that where you will find this fluid. So here you will find this fluid in this here, that is the subarachnoid space. So if you ask where is the this is the dura and this is the epidura, which is this one here. The wide one here is the dura, or the other one, and then the arachnoid is underneath it. So then when you ask where is the pia mater, the pia is going to be attached and stuck to the spinal cord, because this is the spinal cord, so that layer is going to be stuck to it. So then what we deduce from that is that the subarachnoidal space, it is between the pia mater and arachnoid, and this is the subarachnoidal space. Then you can extract the spinal fluid to test it. So all the other things that we were talking about, so this is the ligamentum flavum. As you can see, this is here. This is the ligament that was on top. This is the ligament that was between them. And this is the ligament that is from the inside. And that it will make this cavity. And this cavity, that's where the spinal cord is located. Okay, so then I'll show you another one. So this is the, how you can see, this is the ligamentum flavum, how it is from the inside. The other ligament, which is this one here, this is the transversalis ligament. Okay, intertransversalis ligament, and this is the, I think the same thing, which is the interspinosum. So this is probably from the transversalis, this is the transverse. So the interspinosum is going to be on the back, on the other side, of the things here. But this is the anterior side. The anterior side, this is the ligamentum, a longitudinal ligament. So it's going to cover here all the vertebral all the way up. That is the longitudinal ligament, and that's it.